evening, everyone. Thank you for joining us on our panel discussion. So tonight we welcome you to the DEI Fellowship Panel and Networking event. We are excited to have you for this discussion on dermatology fellowships with our distinguished panelists from dermatology subspecialties, including Mohs Surgery, Dermatopathology, Pediatric Dermatology, Complex Medical Dermatology, Hair Transplantation, and Cosmetic Surgery. And our hope is over the next hour, you will gain valuable insights into the fellowship application process and hear firsthand perspectives from experts in the field. Now, all of our panelists are absolutely amazing and have extensive bios, and I am sad that I had to shorten them, but I do encourage you guys to look them up on your own and reach out. But I will give brief introductions of each of the panelists. So first up is Dr. Alexis Carrington, who is a Sacramento, California native and an ASDS Cosmetic Dermatologic Surgery Fellow in Houston, Texas, where she leads cosmetic clinical trials and specializes in advanced cosmetic procedures. She did her residency at George Washington University and earned her Bachelor's of Science at Pepperdine University. And then she also went to St. George's University School of Medicine. She did her internal medicine year at the Icahn School of Medicine at Mount Sinai, and she is currently a medical media contributor and former associate producer with the ABC News Medical Unit. Next is Dr. Leah Cardwell. She is a board-certified dermatologist and dermatopathologist, currently pursuing a dedicated hair transplant and hair restoration fellowship. She earned her medical degree from Howard University College of Medicine. She also completed a research fellowship at Wake Forest University School of Medicine, and then she went on to complete her dermatology residency at the Medical College of Wisconsin. She has also completed her dermatopathology fellowship at the University of Alabama at Birmingham. Next is Caroline Nelson. She is currently an assistant professor at the Department of Dermatology and the director of inpatient dermatology and dermatology grand rounds at the Yale University School of Medicine. Prior to joining the faculty, she completed a complex medical dermatology fellowship at Brigham and Women's Hospital and the Dana-Farber Cancer Institute of Harvard Medical School. Next is Dr. Hana Ahmed. Hana Ahmed is a board-certified dermatologist and dermatopathologist practicing in Orlando, Florida. She completed her medical school training at Florida State University and her residency and fellowship at the University of Alabama at Birmingham, where she also served as chief resident. And then she is an adjunct professor for the Florida State University School of Medicine and the University of Central Florida School of Medicine. Next, we also have Dr. Latrice Hogue, who is a board-certified dermatologist and fellowship-trained Mohs micrographic surgeon. She earned her undergraduate degree from Duke University and her doctorate degree from Wake Forest School of Medicine. She completed her dermatology residency at Emory University and went on to complete her micrographic surgery and dermatologic oncology fellowship at the University of Miami. And last but not least is Dr. Lauren Provini. She is a board-certified dermatologist and pediatric dermatologist dedicated to caring for children and families in her home state of Connecticut. She completed her undergraduate studies at Yale University and earned her medical degree from Yale School of Medicine before beginning her pediatric residency at Children's Hospital of Philadelphia. She went on to complete her dermatology residency at UCSF, pediatric dermatology fellowship at Yale, and currently serves as assistant clinical professor of dermatology at Yale. Thank you to all our speakers for joining us. We have a number of questions prepared to help guide today's discussion. So let's jump right in. And I'll let Dr. Starling, oh my gosh, Starling, no, I'm forgetting your last name, Starling Haynes, go ahead and start with our questions.
Well, good evening, everyone. Thank you so much for being here. And so our first question is going to be, what drew you to your current subspecialty? And feel free to just go down the line.
I was going to say I could start. So I always had an interest in hair loss conditions in general. When I was in residency, that was certainly a big interest of mine. But in terms of hair transplant surgery, I wasn't quite sure how to go about finding a fellowship. And I did do some research back then, but I had some difficulty with that. I probably could have used a webinar just like this one. But what drew me to it was really the idea of being able to impact patients' confidence. And we know that hair loss has really a significant quality of life impact and psychosocial impact. And I had seen a lot of hair loss conditions, learned about alopecia in residency. And even, when I graduated residency, I did actually practice for 3 years. And one of my niches did end up being hair loss, because that was just really a lot of the patients that came out to see me. And so I ended up building that niche outside of residency as well. And then really the hair transplant piece is really the idea of being able to, not only to impact patients' alopecia from a medical standpoint, but also giving them options from a surgical standpoint as well.
As
You can go
for
next. Oh, go ahead.
no, go ahead.
Oh, it's okay. So as far as my path, when I started residency, I did not have any clue that I wanted to do Mohs at all. At the time, I was really, really interested in hair, and I did like surgery, but it was more of thinking I was going to do cysts and lipomas and that sort of thing. But as I started into residency, I realized, it was a sort of benefit in terms of being able to tell a patient that, you come in for an appointment and quote unquote, we can cure you of your cancer on the same day. Because as you probably have heard or know, a lot of our dermatological diagnoses, we can't necessarily cure them. We're doing a lot of managing. And so it was really good feeling for me to be able to tell a patient, okay, we're going to be able to get rid of this cancer for you, that for a lot of people are very emotional about it and very scared about it. And so it was a process that I kind of evolved into. And I also realized that I really did enjoy the pathology. So Mohs is really a combination of the pathology and the reconstruction surgery piece. So it's important that I enjoyed both of them, because both of them are integral to everything that I'm going to do every day. And so that was kind of my process and why I wanted to do both.
Yeah, so for me, when it came to cosmetics fellowship, I'll be very frank. I was like hemming and hawing. I'm like, should I do it? Should I not? Because yes, you can get exposure in Botox fillers, but not a lot of people do in residencies. Um, so for me, I wanted to get like very comfortable and even get like more advanced exposure in not just Botox and fillers, but also lasers and all of the different, not just aesthetic treatments, but like what do you do if there's a complication, that sort of thing. But there was more to it than injectables and like aesthetics that drew me. A big part of my fellowship, and this was ultimately what made me want to go into it, is there's scar revisions, there's tattoo removals. You do PDL treatments for CBMs, like we would treat babies as young as 5 days old with like very extensive CBMs. So it was truly life-changing work. Um, and we would also do things like tattoo removals for sex trafficking victims or like, who've been involved in sex trafficking. So it was very gratifying and impactful. Obviously, you definitely get the injectables, but there's so much more to it than the aesthetics. And that's ultimately what made me be like, you know what, I'm just gonna do it.
Yeah, I feel like a lot of people don't know that.
Exactly. Yeah, there's a whole world out there.
I'll piggyback off of that. So, I'm a pediatric dermatologist, and what drew me to peds derm is that, I mean, actually, when I had a little bit of like a different path to dermatology. As a medical student, I wanted to be a pediatrician because I wanted to take care of kids, and it was actually in peds residency that I was exposed to pediatric dermatology for the first time on like a resident elective. So I actually like started my pediatrics residency and discovered peds derm through that. for me, in terms of like the content and the patient care, I love how impactful it is for both a child and a family to care for the child, the family as a unit, and to help them to like achieve the skin that is important for their development of their own like self-image and self-confidence. And that's definitely true more for older kids and teens, but to be able to take care of a child and their skin conditions over the course of their development from like infant to young adult is it's very, very emotionally meaningful to me to be able to do that. In terms of the actual care, I think it's very varied. So like you're treating all sorts of derm conditions, from monitoring nevi and other birthmarks to like I got a lot of experience in my fellowship using pulse dye laser to treat port wine stains and other vascular conditions. And so for me, it was sort of like a nice range of like med derm, procedural derm across a span of ages. And so there's so much variety. It's never boring. And in many cases, you get to watch kids grow up, and that is just a beautiful thing.
Yeah, I can go next. So I did a complex medical dermatology fellowship. And for me, what drew me to that was taking care of our hospitalized patients, especially those with really severe drug reactions, which is my specialty, as well as oncoderm patients, and kind of being able to support them through their cancer diagnosis. I think what makes complex medical dermatology fellowship unique, and there are sort of niche different programs offer very different things, but the program that I selected was at Brigham and Women's and Dana-Farber. It was a combination of inpatient and oncodermatology together. Plus, then you could elect to work in bolus or other, autoimmune, whatever you were interested in across the faculty. And for me, I think what drew me to that was the team. Like I got to do multidisciplinary work with specialists all across the hospital. I got to teach medical students and residents and interact with the attending. And I also got to do a lot of exciting research. So it was a year that I would say nothing is quite like your fellowship year. You don't have all of that structure and all that administrative pressure like call as you do as you're a resident, but you don't have the responsibility of an attending. So it's a really valuable time to just grow. You're in a growth mindset. You're just soaking in as much as you can. And it was an incredibly valuable year for me.
Do we have time for one more?
Yes, please.
Okay.
Absolutely.
So I did dermatopathology, and what initially drew me in, it was funny, on one of my away rotations, they took too many rotators, so they put me in derm path for 2 of my 4 weeks. And I had had no experience as a med student with derm path. I didn't even know that derm residents had to know histopathology. And on those 2 weeks, I had a really enthusiastic attending, and I kind of fell in love with it. And throughout my intern year, I chose a place that had a derm program kind of in the same hospital. So I did like a month dedicated for derm path, and I really liked it. And with derm path, you kind of have to know within your first year as a derm resident if you want to do it. So I just went for it, and I found it to be a really nice adjunct to my clinical time, because after a day of seeing like close to 50 patients, sitting at a microscope is such a lovely way to spend your day. So they really complement each other for me. And I feel like, for me at least, my path makes me a better clinician, and then vice versa. My understanding of clinical derm helps me a lot, especially when my colleagues have biopsied a rash and the differential is dermatitis, NOS. I can at least look at the photos and get an idea. So, yeah.
Thank you guys so much.
All right, and that leads us to our next question. So, what made you all a successful applicant for each of your respective subspecialties?
I don't mind going. So, I kind of alluded to this, but for my program, I initially showed interest in DermPath, I would spend extra time down in the DermPath, reading room and sit with slides. So by the time it came time to apply, it wasn't a surprise that I was interested. And I do think, and then, sitting there through 3 years plus fellowship and seeing applicants come in and out, I think you never want to be like a surprise applicant where everyone's like, "Oh, I didn't know you wanted to do this." Like, your interest should speak for itself. And no matter what type of fellowship you decide to pursue, obviously you're allowed to change your mind. And if you find later in your training that, oh, I had an interest in this, that's fine. But if you know deep down, like, I want to do Mohs, or I want to do Peds, or I want to do DermPath, your attendings and your chair and your program director, they're there to help you and advocate for you. And even if it's not at your own program, showing your interest early on, I think, is only going to benefit you. And so when I wanted to apply, even if I would have not stayed at my home program, I know that, my PD for DermPath and even for residency were going to vouch for me. So it's important to show that interest.
Yeah, I also think it's really important to be able to articulate first to yourself and then to the program directors, fellowship directors, how this is going to fit into your career trajectory. So, for example, if you've researched their program, you've talked to people who've done it, you have a really strong understanding of what the curriculum of the program is, and you're able to really show them your passion, but also that you have thought deeply about what the educational experience is going to offer you and how it may transform your career. And I think people who are doing fellowship directorship roles are often doing this because they're just passionate about it themselves. They really want to feel that meaning in taking on an apprentice and training someone. And so they want to pick up on that enthusiasm and understand why should they take the time to invest in you. And so you need to be able to articulate that to yourself and then to them and have that really passion shine through.
One thing that I realized as I was going through my fellowship application was treating it like it's like a derm residency application. So it was, your letters of recommendation are very important. Research for cosmetics was also important too. Obviously, you don't have to have like many publications, but having one or at least being a part of something helps you stand out as well. So honestly, it was just like approaching it like it was another ERAS, like derm application, and taking it seriously, going on to rotations and seeing the practice. Like, the longer you could do, the better, but it's not the end of the world if you can only do one day. It's better than nothing. Main thing in summary was just taking it seriously and not just be like, oh, it's just a application, we'll see what happens. Like, no, it's fellowship.
And then just piggybacking off of what Alexis was saying, I would add mentorship is definitely key as well. So, trying to find a mentor either in, the subspecialty that you're going into, or just someone who can really advocate on your behalf. So I actually had mentors that actually weren't hair transplant surgeons who reached out to my current program director about my acumen, my clinical acumen, my background, my CV, and all of that. And I think that played a huge role in, me ending up in hair transplant fellowship.
And I would agree with what everyone has said so far. I would just add, I think it's very important to make sure that you have a good foundation, that you're a really good resident. You've shown that you're trustworthy, dependable, enthusiastic, easy to teach, especially with Mohs, because it's such a small group of people, and your reputation will precede you. And it's important, especially in that fellowship, that it's more about relationships versus, meeting a checklist. So outside of being, academically strong, you want to make sure that you're showing genuine interest, but also just being a really good resident, treating people well, whether it's the janitorial staff to the attendees to your co-residents. That's very important.
And I would say, I think I'm last for peds. So, peds is a little different because it's, a fellowship where it's not as competitive. And so, there are multiple unmatched fellowship positions every year, like programs that don't fill, just because the interest isn't as high. So, what I would say is if you have any interest in taking care of pediatric patients, like any curiosity, even early on in derm residency, like definitely find opportunities to explore that. I think the peds derm exposure kind of varies across dermatology residency programs. And so like, don't be afraid to, if there's, not enough exposure where you are, don't be afraid to like ask a mentor or advisor in your program to connect you with a colleague at a different institution, or think about using some of your clinical elective time as a resident to maybe see peds derm at another institution, or spend time with a pediatric dermatologist elsewhere who might have like a specific focus and a specific disease group that is interesting to you. Like when I was a derm resident at UCSF that had a ton of peds derm, one of the relative weaknesses at the program was like treating pediatric alopecia. And so I kind of like took my elective time in my final year to spend a month with Britt Craiglow in Connecticut learning about how to care for patients with pediatric patients with all sorts of alopecia, but mostly alopecia areata. And so it's important to like reach out to others in the community and kind of like think a little bit beyond your institution if you have like any interest or passion and you feel like you need to like dive a little bit deeper to figure out if this is the right career move for you. And also pediatric dermatologists are all really friendly, so don't be afraid of them.
Mm-hmm.
I
All really
had
great.
one more point. Oh, sorry. Go ahead.
No, go right ahead.
Oh, I just had one more point I just wanted to sort of emphasize, especially for Mohs. It's important to know that, you could do everything right. You could have a great CV, have lots of contacts, research, and all of that. But sometimes it is a little bit of luck and being at the right place at the right time, the right year for you. So it's not necessarily, unfortunately with derm residency, it's kind of like if you did A, B, and C, you definitely have a good chance of matching. With Mohs, sometimes it's, the right year for you, even if you've done everything correct. So it's a little bit of luck as well.
Yeah. So we kind of touched on the next question with some of these answers. So we could do this as a rapid style. Any additional pieces that you might want to add to that? What common mistakes do otherwise strong applicants make that lead to rejection? So any kind of things that last minute things that we didn't really talk about.
Here, I think it's all about timeliness. Never miss a deadline. Know exactly when the application is due and plant the seeds way ahead of time. If you know that there's a particular, we're going to talk more about networking, I think, later on, but if you know that there's a particular place that you want to go, talking to them early is really valuable. As soon as you're clear on your objectives, I think it's best to, I think that's a mistake that people is waiting. And, our dermatopathology expert also made that comment that you never want to be the surprise applicant. And I would just echo that. I think that can be a mistake.
I think it's already been touched upon, but just being a really good resident is so important because, again, I've seen it where late in the game, someone decides they want to do derm path, and suddenly the tides have changed, and it's like a 180 change, and people notice. People can tell if you're just acting a certain way because suddenly you want to go to that program or stay at your home program. So I think doing the hard work, all 3 years and really showing up every day is only going to make you a better clinician and a better doctor. And it will also speak for you when you want others to advocate for you as well. And like I kind of mentioned earlier, even if worst case scenario, you don't match anywhere at your program or all the programs have filled, if your director likes you enough or your chair, feels strongly about you, they may be able to contact people who you don't even know that there was an opening or something fell through and stuff can work out. So just, you know, put your best foot forward every day. Every day of residency counts.
Okay,
I
and
also
on
think
that,
it's important.
oh,
Oh,
go
sorry.
ahead. Go ahead, Latrice. Sorry
No,
about
sorry,
that.
sorry. I was just going to say, I also think it's important to make sure that you're not putting forth a very generic personal statement. You want to have a good reason and be able to articulate your reason for wanting to go into fellowship and why it's important to you, and along with what everyone has said, showing that genuine interest. So it's really important. A lot of people don't think about that why question. You get it a lot.
Great. And I'm just watching our time and I want us to be able to answer some questions in the chat. So we're going to move on to the next question that was pre-submitted, which are, what are your best approaches to networking? Which some of you guys have touched on this, but if you have any more suggestions and recommendations to the attendees, that would be great.
I would say if you are, in terms of, say you meet a colleague or mentor, I should say, at a conference. So you want to follow up and email them. I would say don't be discouraged if they don't respond right away or even in the next few weeks. Don't be afraid to send a follow-up email because it's likely that they just overlooked it. And so you want to make sure you're being persistent. Of course, there's a thin line between persistence and annoying. So just keep that in mind. But, if it's you sent out that one email, a gentle nudge is always reasonable. And I've had mentees do that to me by, when I give them my phone number by text message or even email. I always appreciate just hey, I don't know if you saw this, but just bringing it to the top of your queue, essentially.
I know it's easier said than done, but don't be afraid to just go up and say hi, or they're humans. Like it's again easier said than done because it definitely can be intimidating. You look up to these people, but I'm just like drawing from an experience that I had with my current program director. It's like I saw him at a conference, I watched his lecture, and I was like, I'm just gonna go up and just be like, hey, I love the work that you're doing. I'm applying this year. Just wanted to introduce myself, and the rest is history. So it's just don't be afraid to just shoot your shot. And the worst that they can say is no, and the world's going to keep on turning.
Yeah, I completely agree with that. I don't think we can ever underestimate the importance of networking. And a lot of it is having the confidence to make that connection. I think thinking granularly about where are some of the best places to meet. So Alexis referred to someone just giving a talk. They're going to be at the podium. You go up, you say hi. And I think that's one place. Another place would be a society-specific meeting. In my case, the Society for Dermatology Hospitalists. I knew Arash Mastagimi was going to be there, and I went up and I talked to him. And one thing that really helps is if your mentor or a trainee at their program, it can be anyone, any other human connection that's meaningful that they already know that person. If you happen to know that person, having that person be willing to introduce you just sort of tacitly says, hey, this is someone I'm willing to introduce to you, and gives you a little bit of sort of respect already going into that conversation for somebody to take the opportunity to introduce you. That's not required. And I agree, you need to have the confidence to approach them independently. But I also think that if you know it, you might feel more comfortable and they might feel more engaged to have someone they know introduce you.
I'll just say ditto to what Dr. Nelson had just mentioned, because I forgot to mention that I had reached out to the prior fellow from like 2 years ago to see if she could make an introduction with my program director. And I also stalked the list of lectures that he was giving, and I definitely went to the front to be sure that I, spoke to him, met him, and followed up with him thereafter.
And yeah,
And I would say the best, oh, go.
no, go ahead,
No,
Latrice.
I'm sorry. I keep interrupting everyone, but I would say the best networking outside of just meeting someone at a meeting is actually working with them. So if you do meet someone and you say, can we do a case report? Can we do a project? Doing something, working with that person is the best networking because they actually get to know you and how you work.
And then I would say, sort of on the personal side of things, like going through residency training is a lot. And so I think in addition to choosing like what subspecialty fellowship you want to do and like where you want to do it, I think there are a lot of personal considerations too in terms of like your family, like what your plans are for the future. And you might be thinking a little bit more long term at that point in terms of like making that life transition to like setting your life up to be what you want it to be. And perhaps perhaps there are geographic ties and things like that. And so I think it's important to like find your person at your residency program. Like I always tell people, like find the dermatologist and attending that like you want to be like in your life and like connect with them as a human. I think that's like something that a lot of people here have said, but also like be really honest about what your personal values are and maybe how some of that ties into like what your vision is for your career and be honest about those things. Like if you want to go to a specific place for a personal reason, it's good to be upfront with the person at your program who's advising you because like they might have personal connections there. And so it's okay to kind of like leverage those things when you're thinking about long term, like where do I want to be for my life?
Really great points, everyone. So we're going to skip ahead to the next question. What do you wish you knew about your chosen field prior to entering it? And everyone can answer this.
So I will say for dermatopathology, for the training, it's very variable between programs. And especially coming from a dermatology background, most places you have to spend half your time doing anatomic pathology and like you're with pathology residents. And that can look really different between different programs. Some places it's more of like observing and shadowing. Other places, they may want you to function like a pathology resident and like do autopsy and do frozen call and things like that. So, in not so much like the actual your attending life, like what a dermatopathologist does, but for that 1 year fellowship or 2 years, depending on where you go, it's really important to like look into all the details of the programs that you're applying to because as late as when I applied, there's no universal application. You had to apply to each individual program. It's important to look and see what that program entails and what what they require of their fellows because it's very variable and you might be the only fellow. And if you're on frozen call and you don't know what you're doing as like a first year, essentially not even a first year path resident. It's just like do your research before you're applying for derm path fellowship because it is not a universal experience no matter where you go.
I would say that's very interesting. I did not know that with derm paths. That's fascinating. Yes, cosmetics is similar to programs are variable. Some are more hands-on than others. Others like shadow, that sort of thing. First point I would make is do a rotation, especially at the places that you're interested in. Some places require like a week-long rotation or one. It's like you can go there for a day. again, and this depends on your program and how much time you have. The longer you can do a rotation, the better, because it just gives you a feel. Honestly, like I feel like a week would be ideal, but even several days is better than nothing to like see, okay, is this something that I can do day to day? And also the research too. Like research is a big part of cosmetics fellowship. Some programs, not as much, but a decent amount are like research heavy. Um, and like have requirements to like complete abstracts, presentations, that sort of thing. That's just part of it. So just be like just have a heart to heart with yourself. It's like, do you care about research? Are you willing to? It's like a mix of residency and research fellowship. That's the best way I can explain it. So you just have to have a heart to heart and be like, can I do this? Is this something I'm comfortable doing? And that's like what the rotations, talking with the fellows, that sort of thing, to get that insight.
The big thing with Mohs is that, the fellowship is only 1 year, so it's more of giving you the foundation of what you will need to take with you, and you actually gain confidence and judgment while you're out of fellowship. As everyone has said before, all fellowships are different, and it's rare that a person is going to get enough exposure to all the different types of flaps and all the different scenarios to say, I feel 100% confident with everything right out of fellowship. So it's a lot of learning and development of your, techniques and all of that outside of fellowship. The key things when you're in fellowship is learning how to think, how to work through a defect, how to plan options, and what are the outcomes that come with different paths you may take for a particular closure. So that's the biggest thing that you're constantly learning.
Any additions?
I think we talk about this a lot, but one of the things about my field is that being in the hospital and doing hospital-based dermatology can be variable in volume and often quite unpredictable. And I think that one of the things that most hospital-based dermatologists start to kind of ask themselves midway through their career is, what's the sprint versus the marathon? How do I make this sustainable for me? I love, doing this. How can I make this sustainable? And I think the most important thing is to recognize that you can always flex into your, and you don't have to be afraid to flex into new roles, becoming more of a teacher, administrator, mentor, versus really when you're at the beginning doing a ton of trenches, hands-on experience to just gain your skill set. And to build the trust of your patients and colleagues. So I guess what I would say, and I think this doesn't just apply to me, I think it applies to every one of us here tonight, is that it's important to don't be afraid to do your fellowship, be all in, and then say, I'm not locked into one career path because I did this fellowship. I'm going to keep reevaluating what's right for me at this stage of my life as my life journey goes on and my career journey goes on. This is one piece of the puzzle, but it's not the only thing. And you're never locked in doing a fellowship. I think it's really meant to expand you, not constrict you. And I guess that's the message that I want to get across.
I love that Caroline said that. And I think, I think something to be aware of, regardless of like what subspecialty of derm you choose, is that it's never too late to like make a change. I know people who, one of my mentors in residency, like practiced adult dermatology and then decided she wanted to become a pediatric dermatologist and like went back to fellowship. So kind of always be reassessing and reevaluating. And if you ever feel lost on the path, like Caroline said, fellowship is just another opportunity to like expand your knowledge base and your practice skills. And it's also not the end. It's not the last opportunity that you'll have to learn. You'll be learning throughout your career. But if you ever feel lost, remember that there are like so many different practice settings that you can be in, and something that I have done multiple times is to kind of just think back to like the vision of what I wanted my life to be like when I decided to go into medicine at all, which like feels like a very distant past decision. And for me, so I just started my own practice as a pediatric dermatologist in Connecticut, and never did I imagine throughout my training that that would be something that I would do. But the thing that motivated me to do that was sort of getting in touch with my vision for like what I wanted my life as a doctor to be when I decided to go to medical school in the beginning. And so you should always be having those internal conversations with yourself and know that like if what you're doing at any one moment in time, that specific thing doesn't feel right, like it's always okay to make a change and expose yourself to like different practice environments. And I think that's something that you should do as a fellow is explore not just what it looks like to practice medicine at the place that you're training, but think beyond that and seek experiences at other institutions in other practice settings, taking care of other patient populations to think about what actually feels like the right fit for you.
Those are such amazing answers, and I really appreciate. I feel like that there's this theme, this message that what you choose now isn't necessarily what you have to do forever, which I think is so encouraging and inspiring. Because they call it early career dermatology for a reason. You might get out into your career and realize, like, hey, I actually want to do something different. Or what I thought I wanted to do actually looks different and what fulfills me in life. And so this kind of leads to our next question, which is what recommendations do panelists have if you don't match? But then also, is it possible to apply and match successfully after graduation or working as an attending?
Can touch on this one. So, again, hair transplant fellowship. I actually was working in general dermatology and dermatopathology for 3 years before applying for hair transplant fellowship. And by the way, I do intend to continue practicing those along with hair transplant. But just remembering that, yeah, it is never too late if you have a desire to seek higher learning in any subspecialty. I think you owe it to yourself to, give yourself that opportunity, even if it feels like, oh, you're so far removed from residency.
Simple answer is yes. Yes, it's possible. One of my mentors, who did cosmetics fellowship, she did it after like almost 5 years of practicing dermatology. So yes, she was able to do cosmetics fellowship. Life's what you make it. Anything's possible.
And I would piggyback on that and agree, definitely. Not matching is not the end of your story. I think the first thing is knowing that, especially for Mohs, not matching does not mean that you're not capable, that you weren't a good resident, or that you wouldn't be a good surgeon. As I alluded to before, it can be timing a lot of times. So just figuring out what can be changed about your next round. And sometimes people get more perspective and more experience by working as a general dermatologist before reapplying. So there are lots of avenues that you can pursue. Some of them have been kind of restricted at this point, but there still are a lot of avenues, especially working and reapplying.
A colleague of mine actually, after I believe 2 years of working, decided that they wanted to go back and do dermatopathology. And I will say a lot of that esoteric stuff will kind of seep out of your brain during, practicing like, bread and butter dermatology outpatient. But I believe he, cut back a clinic day and every week would sit with a local derm path and like sit at sign out and go through slides to reacquaint themselves. And I think he did like a project or something, reapplied, and he matched, and he's practicing as a dermatopathologist now too. And he kind of echoed like working 100% clinical, he realized that it wasn't something he could sustainably do for the rest of his life, and that he in retrospect really appreciated derm path, and he had a lot of regret. And I was like, you can still do this. So he made it work. I think he worked at an academic program for those, at least the year he was like shadowing. They were quite um, receptive and supportive of him pursuing that track and allowing him flexibility. But yeah, I mean, it's never too late to change what you want to do.
Yeah, I think the theme here is that it's never too late, so keep trying if this is your passion. So we'll go to the next question. As dermatologists, we kind of get lucky by having a large variety in our specialties. So we could do surgery, derm path, all these different things. But with fellowship, you kind of feel like you have to go down one specific path. Did any of you have a situation where you were kind of teasing between multiple specialties, like between cosmetics or hair transplant? And really, can you talk about how you made that decision or that thought process went about?
Sure, I can chime in. So, as mentioned, so I'm dermatopathology trained, and now I'm in hair transplant surgery. And I do, as I mentioned, intend to practice all three, which is, I know it probably sounds very extreme to a lot of folks, but what I envision is starting my own practice. And, ideally, hair transplant, anybody who's considering undergoing a hair transplant should have a biopsy to rule out any sort of inflammatory form of hair loss. Not that, if you have like CCCA or frontal fibrosing alopecia, not that that completely disqualifies you as a candidate, but it just gives us an idea of how to approach the case. So, in our practice, we would want to make sure that someone who had like an inflammatory form of hair loss, such as CCC or LPP, that they actually had pretty much in a remission state for about 3 years prior to considering actually a hair transplant procedure. And then making sure that you're giving patients that anticipatory guidance that, they will have to still continue with their medications post-operatively, because they do have this inflammatory form of hair loss. And even in androgenetic alopecia, a lot of people don't realize that, these patients actually do still, I know we in this room realize it, but a lot of patients don't realize that you do still need to be on those foundational medications like minoxidil and finasteride or dutasteride to maintain those results. So, to kind of recap everything, I think that it is possible to, do two subspecialties if you have like a similar goal of maybe starting your own practice and kind of doing a little bit of this, a little bit of that.
Yeah, I would say that one of the themes that we heard throughout the panelists' comments tonight was the value in some ways of diversification of your practice, that we may feel sharper in our clinic if we are occasionally balancing that with a procedure day, or we might feel more energized in the outpatient setting if we've taken a moment to go into the inpatient setting. Whatever it is for you, it may be the teaching or community service. There's so many different outlets, but that, we re-energize one bucket of our work by engaging in another bucket. And I think that way we can kind of constantly, all these different buckets, and infuse what we do with meaning. So for example, I'll just give a more concrete example of inpatient dermatology. I then see my longitudinal outcomes of my patients back, and I take care of them. If they had Stephen Johnson syndrome or DRESS, I see how they do better and I develop these long-term relationships with them, and eventually I'm doing their skin checks. I'm also like teaching in the inpatient setting, but then teaching medical students. And so sort of multiple running grand rounds, like teaching, faculty. So you can sort of find these overlapping, but not, you don't have to march in lockstep. You can find these overlapping themes. I do think it's helpful to have some degree of direction, but in the early stage of your career, one of my mentors, actually my fellowship director, and I love this analogy, so I'll just share it. He said, when you're at early stage of your career, you throw every seed in the ground, you just let that garden grow. And then as you approach that middle point of your career, you start to be like, I'm going to pull up these weeds. This is not going to work. If I don't pull these weeds up, these really plants cannot get to their full form, right? And so anyway, just by way of saying that fellowship is a time when you are planting a tree, but you're going to see what else is there. And over time, you're going to prune that so that you have exactly what you envision for your career. So just kind of sharing that. It's part of the journey.
And I would say this wasn't my particular dilemma, but I've had lots of conversations with people deciding between, Mohs or cosmetics, or whether they should, spend an extra year to do Mohs or not. I think it's really important to, have a conversation with yourself and make sure that if you are looking to do Mohs, that you really, really enjoy all aspects of Mohs, with any specialty or subspecialty. You want to make sure that you enjoy, the bread and butter. I've gotten this advice when I was going through the process. Make sure you enjoy the mundane, the boring aspects of that specialty or subspecialty. So making sure it's with most in particular, making sure you enjoy being at the microscope, looking at pathology, in addition to the reconstruction and the surgery and the problem solving. If you just like one or the other, you may want to think about if it's actually a right fit for you, because it will be all of that. So just having a real good, honest conversation with yourself. I had a conversation with a colleague, and they were deciding between cosmetics or Mohs. And he realized, I really just like the reconstruction and the, sculpting aspect of everything. And so maybe it's better to pursue the cosmetic piece and not necessarily the Mohs. So
And just to piggyback off of that, that leads us into our question that was submitted in the chat from Victoria. Thank you for submitting this question. And she was asking, is cosmetic or laser fellowship worthy to pursue if she wants to do a mixture of general and cosmetic dermatology in practice and won't have access to a multitude of lasers?
I have been itching to answer this question because that was something that I was thinking about. Yes, you can do gen derm and cosmetics. I'm going to be doing gen derm and cosmetics. I miss my rashes. I miss my med derm. So a lot of people do a mix of both. In terms of like the access to lasers, so that's like the tricky part. So I'm going to turn that question back over to you and be like, what would my ideal day be? And I'm just going to give you like some advice that I got from my mentors when I was, again, hemming and hawing on whether to do cosmetics. So one of my mentors was saying like, okay, if you like want to do like Botox and some fillers here and there in addition to your med derm, okay, maybe not like the full-on cosmetics fellowship, but it's like if you want to get the experience in the lasers or in like your practice breakdown, like if you want like 50% roughly is what she said, like if you want 50% cosmetics and the rest med derm, and like that includes injectables, lasers, then yes, like cosmetics fellowship might be something that would help you, or something that would be interest to you. And the last thing, like piece of advice that I was given, it's like you definitely can learn cosmetics on the job, it can be hard because you're also balancing your clinic day to day. Again, nothing's impossible. You can definitely have a successful career with or without the fellowship. But for me, it was like, I know I want to have that advanced exposure in like the tattoo removals, the CVMs, all of that, like I mentioned. So for me, that's why I was like, I'm going to do the cosmetics fellowship, and it can open doors to your practice and get that exposure in different devices. But it's ultimately up to you, like what your ideal day to day and week to week would be.
I will add specifically about the laser too, having just opened a practice and like bought a laser myself. If you have like, I would encourage you to get as much laser experience as you can, even as a resident. And know that like if you're deciding what to do and you might end up talking to like prospective employers for gender and like have an interest in cosmetics, it's always important to ask about like what the laser access is, like what colleagues you'll be able to work with. Because even in like the private practice setting, I find a lot of attendings are like willing to share notes and tips and collaborate on patient care. So like there's an opportunity to learn from your colleagues even after training if you're intentional about it. And then even if you're joining a clinic that has a variety of devices, there are opportunities for education through the companies that manufacture the lasers. So like there's opportunities for them to send out a clinical trainer and spend like a whole day with you in your clinic. You can bring family, friends, etc., to the clinic and like practice on them. But there's like an opportunity even for that sort of one-on-one learning. If you're joining a practice, to learn from like a specific laser trainer that's like associated with a specific device that you want to learn to use. And you don't have to be getting in like at the beginning of the practice. Like those resources are available. Like the practice can provide those to you even years after they bought the laser.
Okay, well, if there are any burning questions, please submit them in the chat. But in the meantime, since we just have 4 minutes left, I want to open up the floor for the panelists to say any last advice or thoughts or considerations that they have they would like to share with the audience.
Follow your heart and know your core values and be, as everyone has said, like be able to articulate them to yourself, but also don't be shy to share them with the people that you want to work with in fellowship and beyond.
I think one other thing is recognize that your fellowship directors can be mentors for life for you. You're not just going to learn something, you are going to connect with people who can be advocates, sponsors, advice givers, people who will really support you in your career. So doing a fellowship is also about the human side of investing in those relationships and taking full advantage of them, giving and receiving in return. And I think that's just like something really beautiful about doing a fellowship that isn't always as obvious.
If you do fellowship, don't be afraid to ask any questions. I know it sounds cliche, but it's very true because you are there to learn. And they are there to teach you, guide you. So don't be afraid to ask any questions. And it doesn't have to be clinical, it could be about life, practice, etc.
Okay, well, and we have about 2 minutes left. I want to thank the panelists for their time and sharing their expertise and insights with us today. And I also want to thank everyone who joined us for the DEI Fellowship panel and networking event and participated in the discussion. We hope that you found today's discussion informative and valuable. And just thank you again to everyone. And I hope you all have a wonderful evening.
Thank you, guys.
Thanks so much,
Have
y'all.
a great night, guys.
Thank you.
Thank you.
Bye. Thank